Well, hello again. It's Bruce Williams, and it's time for Growth Path Challenge 40. And you're going to say, why is it time for Growth Path Challenge 40? Because it's only Thursday. Well, the last couple of weeks, I've had such great response from people wanting both the multiple choice format and the short answer format. I may, in some weeks when I have time, like this week, go to putting two out. So this one is going to be a multiple choice format. Tomorrow's will be in the traditional short answer format. So let's go ahead, get out our pencils and our papers, because you're going to need to jot down 4 multiple choice answers for each question. And let's begin. Before we do that, as I always do, thank you to all my colleagues who provided such fantastic images so I can put this challenge together. Okay, here's question number 1. This is tissue from an ox. What's the most likely cause of this lesion? A. Sarcocystis species. B. Vicia villosa. That's Vicia villosa. C. Is Cysticercus bovis. Or D. Histophilis somni. Think about that. Be right back with the answer. Okay, time's up. This is obviously the heart from an ox. The left ventricle has been opened, and there is a greenish discoloration of the muscle within the left ventricle. If you chose Sarcocystis species, you are correct. The condition is named eosinophilic myositis. It can be seen in skeletal muscle, less commonly in the heart muscle. But the congregation of large numbers of eosinophils often causes a greenish discoloration in tissue. Let's look at the foils. B. Vicia villosa is hairy vetch. Hairy vetch toxicity will result in multifocal coalescing granulomas within the myocardium as well as other organs, including the kidney, so you would have white nodules throughout the heart, not this greenish discoloration. Number C was Cysticercus bovis. Cysticercus bovis is a tapeworm which the ox is the intermediate host from. It generally causes initially, if you see them acutely, you will see classic cysticerci or bladder worms scattered throughout the heart and some skeletal muscles, especially the metabolic active ones of the jaws. You can see them in any skeletal muscle, but really likes ones that are metabolically active, and the heart's always beating. Okay, later on, they will die, they will mineralize, and it will look like little holes in the myocardium. And then finally, D. Histophilis somni is a common cause of myocarditis, but usually causes suppurative lesions or granulomas within the heart, starting with the papillary muscle, often the hardest working part of the heart. So with the Histophilis somni, I'm always looking for abscesses within the papillary muscles. Okay, ready for question number 2. Question number 2 is tissue from a cat. Okay, the key events in the pathogenesis of this disease are the result of the activation of which of the following? Answer A is monocytes and macrophages. B, T cells. C, B cells. Or D, NK or null killer cells. Once again, the question is the key events in the pathogenesis of this disease in the cat are the results of activation of which of the following? Think about that. We'll be right back. Okay, time's up. This question is straight out of, actually it's in Jubb and Kennedy, but it's a great paper written by Anya Kipper et al. In 2014 in VetPath called Feline Infectious Peritonitis, Still an Enigma. It's the takeaway message from this particular paper. Key events in the pathogenesis of this disease. Well, you need to know what the disease it is. We have small white dots which are tracking along vessels. Whenever you see the kidney of a cat with white nodules, you want to consider lymphoma and FIP. If they're tracking the vessels, it's going to be FIP. Okay, that coronavirus-associated disease is a vasculitis. And so when I see them more scattered along vessels than the parenchyma, I'm going with FIP. So let's get back to the question, the key events and pathogenesis of this disease. Classic disease of individuals. You can have 175 cats in a house and only one gets FIP. It's not an infectious disease. What happens is that within the individual, the coronavirus mutates to be able to survive in macrophages. And when it does, then that animal will develop FIP. The correct answer is monocytes or macrophages. Okay? They provide not only the place for the virus to live safely and reproduce, but also their activation causes many of the lesions. Not to say that all of the other lymphocytes aren't involved in these lesions, but they're not the main driver. Okay, Kipper 2014, VetPath. Okay, slide number 3 is tissue from a foal. The question is, which of the following genetic defects is associated with this condition? Answer A, fibroblast growth factor 4. Answer B, SLC2A9. Answer C is ECA10. Or answer D, endothelin 3. Once again, which of the following genetic defects is associated with this condition? Okay, let's look at this particular slide. You can see a couple things. Number one, the small colon is extremely thin and poorly developed. There is distension of the colon proximal to that, and the color of the horse is white. This is known as lethal white foal syndrome. We see it in Appaloosas, which carry the white gene. Animals that are homozygous for this gene will have defects in the endothelin 3 receptor, or answer D, endothelin 3. If we look at the other answers, A, fibroblast growth factor 4, that is associated with chondrodystrophy in dogs. Fibroblast growth factor 3 is a much more famous one, which causes spider-lamb disease. SLC2A9 is associated with hyperuricemia in the Dalmatian dog. Those are the ones that excrete too much uric acid, and it will precipitate an alkaline urine into ammonium biurate stones. You also see that in English bulldogs and animals with portosystemic shunt. ECA10 is one of the genetic defects that is involved in osteochondrosis in horses. So, endothelin 3 receptor associated with lethal white foal syndrome. Okay, slide number 4 is tissue from an ox. Simple question, what is the most likely cause? Tissue from an ox, what is the most likely cause? Answer A is Corynebacterium pseudotuberculosis. Answer B, Vicia villosa. It's a popular foil today. Answer C is Mycobacterium bovis. Answer D is Mycobacterium paratuberculosis. Once again, tissue from an ox, name the most likely cause. Okay, time's up. This one's straight out Job and Kennedy, pages 547 through 551 in volume 2. The correct answer is C, Mycobacterium bovis. Okay, it's probably a lymph node. And Mycobacterium bovis characteristically causes sort of a dry, granular, yellowish, orange exudate. Most of your reactors that are cattle, you'll never find a lesion. Occasionally, you'll find one lymph node, and very rarely you'll find lesions in other organs, which means that this lymph node is probably ruptured into the bloodstream. So then you can find it just about anywhere. You can find it in the lung, you can find the meninges. Very, 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 very rarely you'll find it in multiple organs. So usually it's like one lymph node. But the characteristic exudate, in my mind, is pretty unique. And whenever I see something sort of dry and crumbly, because remember, this is caseate, these are caseate granulomas with a bit of mineral to them. So it gives them that, and caseous comes from the word meaning cheese, so it gives it sort of a dry, crumbly appearance. Let's look at the foils. Cyanobacterium pseudotuberculosis. This would be a good one if we were dealing with small ruminants, sheep and goats. These are chronic abscesses, tend to get very hard in sheep and liquefy in goats. They get so hard in sheep that if the hilar lymph nodes are affected, that animal actually can asphyxiate if it gets big enough. B, our friend Visia villosa, which causes some granulomatous inflammation in the lymph nodes, but we're not giving much respect to Visia villosa today. And D, Mycobacterium paratuberculosis. You will see histiocytic, maybe granulomatous, if you want to use that term. Inflammation in the gut and the mesenteric lymph nodes, also little granulomas in other organs, such as the liver. That was a paper that was written back in the early 2010s, that you could biopsy the liver in animals with Mycobacterium paratuberculosis. I just think it's, you can, but you probably have a higher incidence of false negatives. Okay, so Mycobacterium paratuberculosis causes Johne's disease. The lesion that you'll see in the lymph node will be histiocytic or granulomatous, but will not have this characteristic appearance. Okay, hope you're enjoying this as much as I am, but probably not, because I have all the answers in front of me. Question number 5. Oh, a wonderful picture. This is from a rhesus macaque. The question is, this condition has been associated with which of the following? A, advancing age. B, multiple myeloma. C, generalized inflammation. Or D, all of the above. Once again, in rhesus macaque, this condition has been associated with which of the following? Advancing age, multiple myeloma, generalized inflammation, or all of the above. Okay, time's up. What a great picture. What a great condition. What a great article by Heather Simmons in 2016 edition of VetPath, which dealt with aging pathology in a number of animal species. That was volume 53, 2016, issue number 2. The correct answer for this is all of the above. It made it into the aging edition of veterinary pathology, and we do see this. You don't see it much in young animals, so the frequency increases as animals get older. B, multiple myeloma. I wouldn't have chosen that one, but it was in the article. So that is anything that has to do with lots of plasma cells. Probably has to do with inflammation and amyloid. Did I say that this was amyloid? Well, this is amyloid. I'm sorry I didn't lead with that. Amyloid. There's two things that you're going to see that's going to really cause an increase in the size of a liver in a rhesus macaque. One is going to be amyloid, and the other one is going to be lipidosis. This one doesn't have the orange-yellow appearance of lipidosis, and it looks hard. If you take a liver from a monkey with amyloid and you whack somebody over the back of the head, you're going to knock them out. If you do one with lipid, you're just going to make a greasy spot in their hair, and they're going to be very upset with you. Then you're going to have to run away. So this is amyloid. Advancing age, yes. Multiple myeloma. I didn't know that one, but yes. And I don't think I've ever seen that in a monkey or a macaque. And C, generalized inflammation. Of course, generalized inflammation. Amyloid comes from serum amyloid A. It's produced by the liver. And generally, most of the cases we see in amyloid from any species are the result of chronic inflammation. In primates, there's a wonderful paper going all the way back to 1995 that told a tragic story of a bunch of macaques that had been kept in cages that they were too big for. Over the course of their lifetime, they developed severe osteoarthritis, and as a result, developed severe amyloidosis in the liver, the spleen, and the intestine, developed severe diarrhea. Ultimately, all had to be put down because of screaming diarrhea, simply because of their osteoarthritis and the inflammation that it caused. So the correct answer is D, all of the above. Advancing age, yes. Multiple myeloma, yes. Generalized inflammation, yes. Slide number 6. Oh, we got some histo in here. How'd that sneak in? But this is a great question. Straight out of Jubb and Kennedy. So this is tissue from a dog. What is the most likely cause? What is the most likely cause tissue from a dog? A, Amanita toxicity. B, aflatoxicosis. C, xylitol toxicity. Or D, Depomedrol injection. Depomedrol is a long-acting depot corticosteroid. Okay, think about that one. Well, time's up. We had to pick one. The correct answer is B, aflatoxicosis. Okay, now we got a couple things going on with this liver. Let's take a look. Number 1, the liver is orange yellow, and that correlates with all of the fat that is seen histologically. If I look histologically, I'm also seeing some chronic changes here. Do you see the multiple profiles of bile ducts? A little bit of fibrosis here, which gives a little nodularity. Look at all these bile ducts. So this means that this animal has been injured for a while. There is stimulation of biliary hyperplasia. It's not something that happened overnight. So more of a chronic toxicity. The yellow is fat. The other thing I want you to see, very important, a big fatty liver is going to be bigger. You're going to have rounded edges. Look at how this sort of flops on the table. Looks like it's limp, like a dish rag. That's because you've lost a lot of mass. Okay, it's not your traditional fatty liver. It is a liver that has lost a lot of hepatocytes, and the remaining hepatocytes have accumulated fat. Any sick hepatocyte is going to accumulate fat because it's easy for them to take them in, but it requires energy and protein to package it and re-excrete it. So sick hepatocytes, sick livers take up fat. They tend to get the yellowish appearance, but this one has lost mass. It's lost a lot of hepatocytes. Okay, let's look at the foils on this one. Amanita toxicity. Amanita is a species of mushroom. I could have said blue-green algae, halothane, idiopathic response to trimethoprim sulfa, anything that causes a tremendous amount of hepatocyte death at once. These are acute toxins that kill the liver. They don't have time to get biliary hyperplasia, any fibrosis. Usually there's not enough left to see, much less accumulate this fat. So that's the difference between a chronic low-grade toxin like aflatoxicosis, which ultimately may develop cirrhosis, and Amanita or any of the fast-acting toxins. Xylitol is another fast-acting toxin which causes massive hepatocellular necrosis. When I say massive, it's not lots of hepatic necrosis. It is hepatic necrosis that affects all parts of the lobule. So xylitol is a new one, and it is a artificial sweetener that's often seen in gum. It's an artificial sweetener, and it is toxic to dogs and cats. Not so much to people, interestingly enough. You might not have known that no sugar gum that you're chewing, the same amount would kill a dog. But we don't swallow it, so maybe that's why. Okay, and the last one, Depomedrol, which is a long-acting depot corticosteroid injection. That will give you a yellow liver. It doesn't cause a lot of necrosis. And what you see is glycogenosis, which is a different appearance than the single clear translucent fat globs in the hepatocytes. That's more of a spider cell appearance, and it's glycogen versus fat. There's always a little fat accumulation in severe corticosteroid hepatopathy because those hepatocytes are sick, but it's a glycogenosis change. Okay, 1, 2, 3, 4, 5, 6. Question number 7. Oh, the answer to the last question was in Judd and Kennedy, Volume 2, pages 547 to 551. And here we are at a dog. This is a surgical picture. Okay, I don't know any pathologists that use drapes for autopsies. So this is a surgical picture, and this is tissue from a dog. Can you name the cause? Selection A is Diphyllobothrium species. B, Mesocestoides species. C, Spirometra species. Or D, Echinococcus multilocularis. Here's a hint. It's the cestode special of the day. Tissue from a dog. Which one is this? Okay, time's up. All these are cestodes. The correct answer is Mesocestoides. Mesocestoides, which occasionally will cause a tremendous accumulation of peritonitis in dogs and a number of other species. It's seen in monkeys or macaques as well. I wish that if you had a motion picture of this, it would be really striking and terribly gross. People have described this as moving tapioca pudding, when they look down and the abdomen is full of this thick exudate with these moving tapeworm segments. Mesocestoides. Okay, A and C, Diphyllobothrium and Spirometra, are both cestodes which live within the muscles. Intermediate host is fish or frogs, and you eat the fish or the frog, or you contaminate a wound with frog parts. People have gotten it from using frog or poultices containing frog innards as wound dressings. So don't use frogs as wound dressings. And then finally, Echinococcus multilocularis. Not a bad thought, and this is a dog. And both the intermediate host rarely and the definitive host of Echinococcus multilocularis is the canid. Usually the definitive host, and those are small, traditionally shaped tapeworms within the gut. And the intermediate hosts are rodents or a number of other species, including man, and they cause sort of a bubbly appearance because the hydatid cysts continue to divide. So it's sort of golden soap bubbles within the liver and within the peritoneum. Much more space occupying than these particular tapeworms. So great picture, Mesocestoides in a dog. You can look that up in Judd and Kennedy, Volume 2, page 223, if you want to know more about that. Okay, number 8 is an old picture from the Wednesday slide conference. We get this on a fairly regular basis, and this is tissue from a horse. What is the most likely cause of this lesion? Well, this test, a lot of these are out of Judd and Kennedy. This is Volume 2, page 217, but don't look it up until after you've at least taken a shot at this question. Okay, tissue from a horse, most likely cause, and your possibilities are A, cyathostome infection, B, Salmonella typhimurium, C, Neorickettsia rusticii, or D, Banamine toxicosis. Chew on that one for a while, and I'll be right back. Okay, I'm back. The correct answer is A, cyathostome infection. Cyathostomes are small strongyles which live pretty much exclusively within the cecum and the colon. And within the colon, they're very small, and we're a long way away. People call this a salt and pepper colon, okay? Because all of these little nodules that you see are the encysted L3 and L4 larvae of cyathostomes. You will see the cyathostomes when they hatch out on the surface. They are little red blood-sucking parasites. I don't know, this could be one right there, or it might just be a little bit of grass. We're too far away to tell, but we're not too far away to make this diagnosis knowing that this is the colon of a horse. Okay, and they all live in little granulomas beneath the surface, and you'll see the worm within the granuloma. The granulomas are generally sort of reddish black in color because there's blood within them. And usually you will see this in animals that in which the parasite is undergoing hypobiotic maturation, or it sort of locks itself in to this stage until the environmental conditions outside the horse are beneficial for its continued survival. How they know that it's wintertime outside or it's drought or whatever, I have no idea. Okay, but I know that this cyathostome infection, where we don't see many large strongyles anymore, Strongylos vulgaris in animals that are on warming programs is sort of a thing of the past. But cyathostomes have developed an immunity to ivermectin, so we still see this, and they're probably the most important nematode right now for animals that are on a good warming program. Your other choices was Salmonella typhimurium. Hey, Salmonella typhimurium is the great imposter, and within the intestine, the cecum, or the colon can look like anything from just a little bit of edema to a severe hemorrhagic enterocolitis with sloughing of the mucosa. One thing it's not going to do is these little dit dots throughout the colon. Okay, number C was Neorickettsia rusticii, or the causative agent of Potomac horse fever, or my favorite name, Shasta River crud. We vaccinate for that. I just vaccinated our horse last week for Potomac horse fever, although I think I'm throwing my money away because that is not a very effective. The animals only seroconvert about 33%, but the barn required us to give that vaccination. It generally causes something that is a lot more edematous, not a lot of hemorrhage. Really severe cases can be necrohemorrhagic, but most of the time you get this big, boggy, edematous-looking colon. And then finally, Banamine toxicosis. Banamine toxicosis will certainly cause severe lesions in the colon, sloughing of the mucosa, especially in the right dorsal colon. You could have stretch ulcers, circumferential areas of fibrosis. A lot of looks to that, but not this dit dot, which is pretty classic for cyathostome toxicity. That usually turns up at the Wednesday slide conference every other year because we get a lot of them. So make sure you take a chance to look that up, or at least check out page 217 in Jubb and Kennedy in volume 2. Okay, you only have 2 more chances to shine here, so let's make the most of them. Great picture, Dr. Oscar Quesada from Gran Canaria University, and this is tissue from a sheep. What's the most likely cause of this lesion? Your choices are A, fascioloides magna, B, fasciola hepatica, C, cysticercus tenuicalis, or D, dicrocilium dendriticum. What is the most likely cause of this lesion? Think about that. And time's up. Okay. We have our choices are 3 trematodes and 1 cestode. Okay, the correct answer is the cestode, Cysticercus tenuicalis. Normally they don't cause any problem, and this one didn't either. But on their way to becoming large cysticerci, which are present within the abdomen of the sheep, they do have a migration through the liver. It's through the parenchyma of the liver. It is unassociated with any of the bile ducts. And they're sort of these serpiginous tracts. They're usually elevated, somewhat hemorrhagic. They show up really nicely if the animal has a little bit of a fatty liver too, but this one showed up very nicely. Okay, so this is Cysticerca tenuicalis. This is the migration tract of the immature cestode. Okay, your other 3 choices were flukes. Fasciola hepatica, B, and D, dicrocilium dendriticum, live within the bile ducts. You will see fibrosis of the bile ducts. Okay, so these will be white serpiginous tracts on top of the liver. Very easy to pick up that they are within the bile duct. So those are not good choices. And then A, fascioloides magna. Yes, you get black lesions, but you get large black tracts. Huge black tracts as these large trematodes go through the liver, destroying it, causing inflammation, fibrosis. They are, and generally fasciola Fascioloides magna do enough damage in a sheep liver, anything smaller than a cow, to cause a fatal infection. Doesn't take much of Fascioloides magna. Okay, I did not mention black disease. Black disease is a disease of cattle, which are caused by the immature the migration of the immature forms of Fasciola hepatica. They got to travel through the parenchyma too on their way to the bile ducts. Usually they're in very large numbers. That's the one that causes black disease or activation of Clostridium novii in ischemic areas. Not Fascioloides magna, as a lot of people think, because magna deposits a lot of black pigment as it travels. Not the one that's associated with most cases of black disease. Okay, cysticercus tenuicollis, when this got to the outside of the liver, it will cause a cysticercus, which really doesn't cause any problem. You'll see them within the abdomen and on the capsule of the liver. And this is sort of an incidental finding, but you got to know those too, so you'll know what the pathogenic findings are. And finally, question number 10. This is tissue from an ox. What is the most likely cause of this lesion? A, bovine herpes virus 5. B, excessive dietary sulfur. C, Histophilus somni. Or D, Aspergillus fumigatus. Most likely cause of this lesion. Okay, your time is up. If you chose A, bovine herpes virus type 5, you are correct. This is a disease that causes a necrotizing encephalitis, especially in younger animals. It's most commonly seen in South America. They know it very well down there. Don't see it much here in North America. And it causes these multifocal cavitating lesions. Classic lesion of bovine herpes virus type 5. You may not live in South America, but I don't believe there's anything like a regional pathologist anymore. I know so many pathologists who work all around the world. I think it's incumbent upon us to know diseases of many different countries. And I'm always really excited to get a picture of a new lesion in a country, even the ones I've never been to, because it expands my knowledge. B. Choice B was excessive dietary sulfur. That's one of the causes of polioencephalomalacia, but polioencephalomalacia is generally not that patchy. You will see a deepening of the sulci. You may see swelling of the cerebrum with flattening of the gyri and herniation of the cerebellum through the foramen magnum. I'm not sure. You might have a little herniation here. Anything that causes swelling of the cerebrum is going to push everything back, and there may be a little herniation right here. Choice number C was Histophilus somni. We didn't give Histophilus somni much respect today either. It's been a foil on a couple of questions on the ox, and this traditionally would cause thrombotic encephalomyelitis. And it will cause hemorrhages on the surface of, within the parenchyma of all parts of the brain, primarily the cerebrum. It causes a vasculitis, thrombosis, and necrosis of the tissue. It just doesn't cause these big divots on the surface of the brain. What you see are more hemorrhages than these actual areas of hollowing out. And D, Aspergillus fumigatus, I threw that in there. That's a fungus. It causes granulomas in the brains of poultry. Occasionally, I think you might be able to see it probably in some animals, maybe some ruminants following ruminal acidosis, but I'm not familiar with it causing these type of really depressed infarction-like lesions within the brain. So a great picture of bovine herpes virus type 5, also from an old Wednesday slide conference. If you want to read more about this, consult the Wednesday slide conference, or you may look it up in volume 1 of Jubb and Kennedy, pages 381 to 382. Well, that brings me to the end of this. These multiple choice ones, I know I talk a little faster, but the good thing is you can always slow it down, say, what did he say? And go back and look again. Hey, I hope you enjoyed this. I hope you're looking forward to tomorrow's short answer version of the Gross Path Challenge, and you'll come back for that. As always, I wish you all wonderful health and a fantastic day.